So today we are discussing grief and bereavement. And I'd like to open with a message from Institute for Mental Health Research co-founder Lauren Meyer, who couldn't be with us live today. So here is Lauren.
Thank you for joining us. I don't usually speak at these webinars, but this one is personal for me, and I suspect that it might be for some of you as well. I lost my father, Malcolm, about a year ago, but the ache is still very fresh. My dad was the most social, vital man imaginable. So the idea that he spent 5 weeks in the hospital alone and died without our family surrounding him is an unbearable reality. Like me, you may have tried desperately to manage your loved one's care remotely, and you may struggle today with questions about your family member's final hours. Like, would the outcome have been different if you could have been there advocating for them in person? Or was their death made more painful because you weren't there? Or perhaps, like my family, you weren't permitted to have a proper funeral and the important rituals that go along with it. And I don't know if you feel the same way now, but as life gets back to normal, I am acutely aware that there is a permanent fissure in our family and that normal as we knew it simply doesn't exist anymore. Please know that we are not alone. There are well over 5 million of us trying to cope with the lack of closure and grief that came with COVID. At the Institute for Mental Health Research, we understand that there are endless unanswered questions about our mental health. And last year, it was clear to us that the pandemic would further complicate our world, not just with physical illness, but with mental illness that followed in its wake. So we created the COVID-19 Impact Fund to accelerate COVID-related research. The Institute for Mental Health Research was started 20 years ago because we recognized the dire need to improve mental health across the lifespan. And that only comes with understanding it through research. What makes our institute unique is that we are statewide. We encourage collaboration across all academic institutions, medical centers, and providers, and we direct our funds only to Arizona scientists who are conducting early-stage mental health research, an area that historically receives scant funding. I have been with the Institute from the start for over 2 decades now, and I am more passionate about our work than ever before. Our ability to fund these brilliant scientists as they strive for cures and treatments comes only from people like you. With generous contributions from some of you here today, we were able to fund our first COVID projects early in the pandemic, and they are now well underway. And just last month, we awarded a grant to today's speaker, Dr. Mary Frances O'Connor, who will be studying exactly what I've been sharing, the complicated grief that arises from loss during COVID. Her work is novel because she focuses specifically on the neurobiological, immune, and autonomic responses to grief. I hope that you will consider making a meaningful gift so that we can continue to fund the research that will help bring hope to people who have suffered and are still suffering today. It is now my honor to introduce you to today's moderator, Dr. Jordan Karp, another one of those brilliant scientists. Dr. Karp is professor and chair for the Department of Psychiatry at the U of A College of Medicine and clinical service chief for behavioral medicine at Banner University Medical Center in Tucson. We are fortunate that he also serves as a member of our board and our scientific advisory council. Stay tuned for Dr. Karp's webinar in September, at which he will help us understand and prevent cognitive decline late in life. Dr. Karp, I turn it over to you.
I want to thank you, Angel, for your great coordinating, and I want to thank Lauren for her warm introduction and welcome. I'm happy to be moderating this important discussion since the study, prevention, and care of patients living with complicated and prolonged grief disorders is something I've cared about for the past 15 years. Grief is a part of being human, and its severity occurs across a spectrum. But when grief does not resolve, when it interferes with daily life, and when it worsens our mental and physical health, we need to understand this lived experience and associated neurobiology so we can help our patients, our families, and our communities. Our guest speaker today is Dr. Mary Frances O'Connor. Mary Frances is an associate professor at the University of Arizona's Department of Psychology and the director of clinical training. She has received funding from the National Institute of Aging to study complicated grief in older adults, with a particular focus on neural activation, immune markers, and neuropsychological tests of attention and emotion regulation that may explain why some bereaved older adults develop complicated or prolonged grief disorder and why some do not. Mary Frances also serves as the director of the Grief, Loss, and Social Stress. This is also called the GLASS Lab at the University of Arizona, where she studies both the psychology and the physiology of bereavement. Recently, our organization, the Institute for Mental Health Research, awarded her a grant to investigate how quarantine-era loss appears different and more complicated than loss during normal times. It's a particular honor for me to introduce Mary Frances as a scientist colleague at the University of Arizona, who's doing impactful, patient-centered work, and as an awardee from our organization, IMHR, to support her work. Mary Frances, we're honored to have you with us today, so please take it away.
Jordan, thank you so much. And thank you to Angel as well, who's been our fairy in the techno world and has done an amazing job getting us all herded into this webinar today that we get to share with you. I'd like to start with a land acknowledgement. The University of Arizona is on the land and territories of indigenous peoples. So today, Arizona is home to 22 federally recognized tribes, with Tucson being home to the O'odham and the Yaqui. So I always like to take a moment to recognize where we are in the world, where we are in space, and where we're coming to you from in this virtual seminar. Now, my discussion today, my presentation today, will in fact come from this research that I've been doing at the GLASS Lab at the University of Arizona, as Jordan mentioned. And it really is about pandemic grief. So what we know is that for each of the COVID-19 deaths, an estimated 9 surviving Americans will have lost a grandparent, parent, sibling, spouse, or child. Bereavement specifically elevates risk for other mental illnesses and disorders, and just in general has really terrible consequences often for social and economic well-being for individuals. So this is a really unprecedented level of mortality that we have seen within the last year, just over a year, in this country. But here's the good news. I like to start with some good news. Over 60% of people, when we study other traumatic losses, like losses from 9/11, losses from plane crashes, or losses from natural disasters, we know that over 60% of people are resilient, and only 10% develop what we call prolonged grief disorder, which I'll tell you a little bit more about. The reason I think this is so important is because right now, we are still in what we would consider to be the acute grief phase for most of the COVID-related deaths, or the deaths that have happened during this pandemic quarantine, even if they weren't related to COVID. Acute grief is expected. It is a form of universal suffering that is distressing and takes time. But it is also a natural response to loss, a response that our minds and our brains and our bodies have evolved to cope with. However, there is some portion of people, about 1 in 10, who never seem to really adapt after the death of a loved one. So when I say prolonged grief disorder, you can see in that smallest circle there in the egg, prolonged grief disorder has specific criteria and is distinct from complicated grief in that you can think of the way that depression and a diagnosis of major depressive disorder are distinct. One is a disorder that has specific criteria that's usually provided by a psychologist, psychiatrist, and it really by definition means that there is a lack of daily functioning, that the person's ability to get to work, to get food on the table, to get the grocery shopping done, has really been impacted. Now, I like the term complicated grief, and I'll tell you why. Complicated grief is a slightly older term, but I think of it this way. If you break a bone, let's say you break your leg, we don't actually do anything to knit those bone cells back together. That is a natural process that our body has evolved to do. We might provide support for it. So we might put it in a cast, we don't walk on it, we do various things to protect it, but it's going to heal on its own. Even though years later, if a doctor looks at an x-ray, they can still tell that it has had a break in it, right? And in the same way, grief affects us forever. However, what can happen with a broken bone is that we get complications. Let's say there's a second trauma to the break, or an infection sets in. And these are complications that we must intervene with in order to get the person back on their normal healing trajectory. And I think of complicated grief in a similar way. Something has gone awry that has taken a person off course so that the normal support that their family and their community provide is not enabling them to move along the trajectory that we anticipate with typical grief. However, we know that there is additional context around bereavement. So in the case of COVID-19, there were much higher mortality rates in our Black, Indigenous, and people of color communities. And additionally to COVID-specific mortality, there were higher suicide rates and overdose deaths in these under-resourced communities. And so as we move forward, we need to make sure, as we do research in pandemic-related grief, that we're oversampling the communities that are exposed to the greatest impact. Now, as Jordan mentioned, I have had the really great fortune of being supported by the Institute for Mental Health Research, about which I am really delighted, and has enabled me to start a research project this summer looking at pandemic grief. And from some of the just very, very early data that I've been collecting, we can see that even in these early data points, that the grief reaction may end up being higher in our minoritized communities than in our non-Hispanic whites. That doesn't mean that it's not impactful in all individuals and all lives, but it does mean that we want to make sure, if we're thinking about how to intervene, for example, that we're taking into account the context in which that's important. So here is the question that I get asked. Is grief different during the pandemic? So there have been so many circumstances and characteristics of COVID-19 that make it unique from anything we have ever experienced in our lifetimes. As was mentioned earlier, some of those include things like really unexpected deaths, individuals we did not expect. It was too soon for them to go. But also healthcare policies that prevented bedside visitation during end-of-life care in hospitals, but also in long-term care settings. And the absence of in-person funerals and memorials, which are so important traditionally to how we understand that this person has transitioned from being on our physical plane, where we can provide them daily care and love, to a place that we aren't able to be in regular contact with them anymore. There were other circumstances, of course, financial stress, caregiving stress, social isolation. All of these can contribute to worsened grief outcomes. And so as a psychologist, I anticipate that this may precipitate a wave of prolonged grief disorder, so that even if we're dealing with 10% of those bereaved individuals, that's still a very high number when you look at the mortality rate that we've seen in the last year. But importantly, this is an empirical question. This is where the scientist in me is like a small child who's always asking, but why? Why is that? But why? And so I want to share some thoughts with you today. So our grief, loss, and social stress lab has been doing grief research for about 20 years. This is not a new interest for me because of the pandemic. And so we know a lot already about what typically happens in grief. So we are conducting a 7-minute online survey of bereaved Arizonans who've experienced the death of a loved one. And there's a link here, which you'll be able to get to in the resources after the webinar. And it was funded by the Institute for Mental Health Research. Now, once people have participated in the online survey, they are able to generously offer that we can follow up by phone and go into more detail with them. We're oversampling Latinx and other participants. And and this was the point there, that participants can opt in to understand more about what helped and what didn't help during that end of life care and during the funeral and memorial phase of bereavement. I want to share with you some of the things I've been hearing about the thoughts people are having as they face bereavement during the pandemic. Not being able to have a memorial service has been hard. I feel like that's maybe why things haven't sunk in yet. It feels like she was just here and then she wasn't. There was nothing that made her death seem real. Another person told me, my grandpa had dementia in a nursing home. He was moved there 2 weeks prior to lockdown. And the staff told us he didn't understand why family didn't come to visit anymore and that he felt abandoned. Knowing that he felt we abandoned him has been the hardest part. The thing is, these are not unique comments. And I think that as a culture, we need to think about how we're going to respond to these people who are experiencing this. But as I said, there's been a wide range of experiences. And so another participant told me the only significant factor was not having a large organized service. Under the circumstances, it was actually better having a small casual gathering of our small family. And so here's a person who is seeing a uniqueness about the pandemic that they found meaningful. Another person tells me, I know death is a part of life, and although sad for a time, and I thought it was unfair, I remember that he had a good life, and I'm okay with it now. And this is a trajectory we see quite frequently. People have a period where they think about the unfairness, the what ifs, the would have, could have, should have really stick with them. And then they're able to incorporate an understanding into their lives and restore what to them feels like a meaningful life. Now, these thoughts, we sometimes in psychology called rumination. So rumination is the sort of brooding. These are thoughts that just keep coming back. You're trying not to have them necessarily, but they're just always there. And when we think about something like a COVID-19 unexpected death, there's not much we can do to change that. But what we can do, even if that is predicting greater grief severity, what we can do often is intervene for folks in those thoughts specifically, that rumination. Now, that rumination is often associated with the negative mood, feeling worry or sadness, often guilt, very frequently guilt. And we come to think of sort of flavors of what people end up thinking about. One of them is the would have, should have, could have that I mentioned. Another is the justness of the death, feeling very angry that this should not have happened, or it should not have happened to me or my loved one. Another set of thoughts revolves around whether this is normal. Have I been grieving too long? Am I grieving too much? A lot of people also will say, I feel like I should be feeling grief, but I'm not, and I don't know why. And yet another set of the thoughts include how other people are reacting to one's grief. So feeling, my family and my friends they don't understand, they're not being supportive enough, or how can other people just go on and act as though nothing has happened? So sort of the other perspective on one's grief. So these are some of the flavors that we see typically as people are thinking about their loss. The good news is we can intervene with intervention, with rumination. And we can do that in a variety of ways. I'll talk a little bit more about professional intervention shortly. But I want to turn just for a moment to think about additional reasons that it might be important to understand grief. And this gets to some of the other aspects of the research that I was doing prior to the pandemic. So beyond psychology, bereavement has an effect on our physical health as well. So for example, in a study of 1.5 million people from Finland, so pretty good sample size, heart disease was twice as high in men for the first 6 months after they lost their wife compared to married men. In the US, mortality risk in a very large study was just short of twice as high, 1.87. And this was when they adjusted for every possible thing you could imagine: the age, the risk factor, smoking, and whether they had other comorbid diseases, diabetes, and so forth. Even with including all of that, we still saw that the risk was higher. Now, the risk is also higher for women who lose a spouse. It isn't as high as it is for men. It is more in the 1.5 times the risk. So to me, this has always struck me as this is real evidence of a physical impact of loss. If you're controlling for all these other things, there's something about the psychological event that's impacting our physical body. And I find that fascinating. And I'm hopeful that if we can understand more about how and why, that we might be able to assist these folks who are going to have medical responses to bereavement. So in thinking about, well, what can be going on here? I want to give you some biomarkers or some mechanisms that we think might be involved. So one thing that we know is that when someone has experienced the death of a loved one, their average heart rate goes up. So in this graph here, we can see that at baseline, so shortly after, in the first few weeks after the death of a spouse, the bereaved person's heart rate is over 75. That's the average heart rate. And then it beats per minute, right? And then if we look at 6 months later, you can see their heart rate has decreased in the light blue bar. So the bereaved person, you can see their heart rate is coming down in that first 6 months. And when you compare that to a group of people who are the same age and have all the same risk factors, their heart rate doesn't change very much across 6 months. So that's one thing to know. But also you can see that the bereaved group has a higher heart rate. Well, higher heart rate puts a bigger strain on the heart. And so we know that this might be part of a mechanism that is leading to some of that cardiovascular events that are causing mortality ultimately. In this one, I'm going to show you a biomarker from the blood. It's called von Willebrand factor. No one is going to remember that. But the point is it's associated with having a stroke. And you can see that it changes in bereaved people here over 6 months. And finally, that cortisol, one of the stress hormones, also changes. I see Jordan here, and I have a feeling I may have gone beyond my expected time. Jordan, is that true?
Do your best. We're really learning a lot from what you're sharing. So yeah.
This is a very similar slide from my own work showing that inflammation is higher, circulating inflammation in bereaved individuals than non-bereaved individuals. And I'll just show you the prettiest blobs from the brain that suggest that also the way that our brain responds to grief differs for people who are having more grief symptoms. We want to just leave you with a few things to try that might facilitate good coping, and then some resources at the end. We can talk more about these in Q&A. I think we'll have an opportunity to have a really interesting discussion. So I'll just sort of list them here and we can dig more into it. So understanding that grief doesn't end per se, but we continue to build a meaningful life. And paying attention to where you are, what's your story, and are you engaged in what you find meaningful? Developing a whole toolkit of ways to respond to that pang of grief, that sort of wave of grief that overwhelms you, that can contain a whole bunch of different options that you can try at different times. recognizing when you're having that perseverative thoughts, right? The would have, could have, should have, and find ways to break that thought cycle. Identifying what you might be avoiding with relation to the loss, people or conversations or places you're avoiding, and taking small steps to try and engage again. And then finally, recognizing when it's time to seek professional support. I list some resources here. Some of them are online and some of them are books. Those will be available through Angel after the webinar. And finally, because I know you are local to Arizona, a former graduate student of mine, now clinical psychologist, Dr. Arizmendi, lives in Phoenix, also does teletherapy, and has been trained specifically in therapy for prolonged grief disorder. So thank you very much.
That was excellent, Mary Frances. Thank you for sharing your work, and it's really inspiring, your dedication and the scope of projects that you've worked on in this area. As you were talking about the physical health effects of grief and complicated grief, it made me wonder if that's where the term dying from a broken heart maybe came from, because there are such catastrophic, for some people, physiologic and biological effects of losing someone. It really is traumatic.
That's really interesting. That is, in fact, where the term comes from. And I think in many ways that folk wisdom has been around for a very long time. And now we just have sort of the numbers and statistics to prove that.
We're trying to understand and learn more about the mechanisms that support what people have observed for centuries, right? Can you talk a little bit more about how a person or a physician or a psychiatrist can distinguish complicated or prolonged grief from depression? Because they're different and the treatments are different.
Yeah, that's a really excellent question. And it's not something I think we've understood for a very long time. So the investigation into grief by the sort of psychiatry community has been more recent than certainly in depression. But I think we've come to find a few markers that help us to see what the difference is. And one of those is that for a person who has prolonged grief disorder, their distress really centers around this person who's gone and the consequences that has had for their life. So it's very much about yearning for this person, not being able to get thoughts of them out of their head, feeling angry with other people who haven't lost someone. It's very focused on the loss. Depression, on the other hand, which is such a difficult mental illness, really attaches itself to anything going on in your life, doesn't it? Mm-hmm. So it can be that you do feel depressed about having lost this person, but in addition, you're also depressed about other things you've done that you feel guilty about from parts of your life, or you feel very hopeless about, the state of the world, the future of the world, that's not really related to your loved one, but has this sort of global blanket over all the things that are happening.
I think that's a good, important way to distinguish the two. And whether it's normal grief and bereavement or complicated or prolonged, grief does come in waves. And so it's not a constant black dog, which is encompassing everything. It is more focused. And the wave-like experience can be really dramatic, but it also does mean that there are times when it lets up.
That is such a good point, Jordan. Absolutely. And I think people in the moment will tell you, I've never felt so terrible, but it passes, right? So it does come in waves. And also, I think people are often caught off guard at an anniversary of the death, mm-hmm. or a holiday or the birthday of the person, right. That during that period around the remembrance, they will feel worse. And they'll often tell me, but I thought I was doing okay. And now I'm I'm doing terribly. That also will pass and is a lot about remembering.
Yeah, no, it's useful for people to be aware that an anniversary is coming up, and also that these emotions will pass after the anniversary. So, as I've thought about complicated grief and prolonged grief over the years, I've always considered it a blend of symptoms of post-traumatic stress disorder, rumination, and avoidance, because there's so much avoidance of feelings, of events that remind somebody of the loved one. For example, people can't drive past certain restaurants that bring up too many memories, or they can't get rid of belongings. this sort of segues into this question of what's the right treatment for complicated grief? Because grief therapy can be helpful for lots of people, and most people don't need it, but it's different than complicated grief therapy. And I'm wondering if you could talk a little bit about what's special for treating this kind of response to loss.
Yeah, it's such a good question. You know, I think as human beings, for whatever reason, when we've lost someone, we often feel the need to explain what is happening and what has happened. And so having grief support around you, whether that's your family or a grief support group or online or wherever, can be very helpful to just put into words what the heck just happened and how you're reacting and how it's unexpected and how it's changing. And all of those things are really helpful for people in the normal reaction to loss. There's a difference, though, often when someone has prolonged grief disorder. The first thing to know is we don't diagnose it, according to the DSM, until a year after the loss. And so part of it is just we expect it to take time for people to adapt, so that if they're still having difficulty getting food on the table and getting to work and so forth after a year, then we start to think this might require more than just support and an opportunity to talk. And so at that point, it's more, there's some specific complicated grief therapies that have been developed, and they vary in a few ways. There's a sort of cognitive behavioral therapy that can be used, and then there's complicated grief therapy specifically. But the point of them is really, it's not just about getting a chance to talk. It's about really reflecting on what has changed in your life, how those thoughts are impacting you day to day. And so being able to sort of let yourself feel grief and pull yourself out of it or regulate that emotion, sort of practicing going back and forth so it feels more natural in the day-to-day life. And then finally, the thing you were saying about avoidance, people often end up developing sort of habits around avoiding things that ultimately would probably make them feel good. So they avoid, you know, seeing friends that they used to see, even though seeing friends is a really important part of just being human. And so if you've sort of over the year ended up developing some of these habits of avoidance, it can take another person who's sort of seen these habits before to point them out and really encourage you, you know, come up with a list of small steps. How might you engage? And help you to do that over a brief period of time.
I think that's excellent what you're describing. When I was trained in complicated grief therapy, it's a really tough therapy that uses a prolonged exposure approach, and patients would tape their experience of the loss and listen to it over time, but it was blended with positive behavioral activities and connecting with people. So it's re-engaging, but also feeling more in control of these traumatic feelings.
Yeah.
We're almost near opening up to the audience Q&A, but I had one last question I'm hoping that we could talk about is, what are some risk factors besides losing somebody in this crazy circumstance of the pandemic? What are some patient level risk factors that put somebody at elevated risk of developing prolonged grief disorder?
Yeah, it's a good question, a frequent question. So we know that women, as with all the mood disorders, are more likely to develop prolonged grief disorder. We also know that people who have had difficulties in what we would call the attachment system, what I mean by that is, if you were a kid who had a lot of separation anxiety, that part of your system is more fragile, less resilient. And so the death of a loved one can sort of tap into some of those same social anxiety, separation from loved ones issues that existed before. So any pre-existing mental health issue can be a risk factor. And then other things include a real change in your economic situation. So just the secondary stressors of losing a co-parent or a breadwinner, or having to move houses because you can't afford to be where you were before, these secondary stressors really can exacerbate the problem, make it harder for you to adapt sort of typically. And the last one that I would say is not having enough social support. So especially for older adults, often their social circle is pretty small.
Yeah.
And the death of a spouse, for example, or a sibling can really narrow that very small circle even further. And so not having people to support you can be a predictor as well.
That's really helpful to share that with everybody. It's useful reminders of who may be at risk. One of the things that I learned while working on a complicated grief project was that, and I had been taught that it was ambivalent relationships where you had mixed feelings about the person who was lost that put you at risk. That wasn't the case. It was people who had very, very close positive relationships and they felt like they had lost half of their self. Those were the folks who were at the highest risk. Well, we're at the time to bring in some questions from the audience, and we have some great questions here. So
it's like lots of really engaged people with us.
Yeah, a lot of people are loving this. Let's start with the first one. How does grief exacerbate other mental health conditions and how to address?
Yeah, this is sort of the flip side as well. If one already has struggles with mental health conditions, bereavement is an additional stressor. And we know stress is not so great for all sorts of different mental health conditions: depression, anxiety, schizophrenia, bipolar disorder. There is also some sort of specific situations. Often a loved one has been a great source of support in helping you to manage and regulate during sort of periods of having more mental health problems. And if that's the person who's died, now you're missing the sort of basic support that has been there to help you navigate. The last piece I would say is that insomnia is very frequent in bereavement. And so this is a sort of very specific stressor. Your brain and your mind need sleep to sort of regulate well. And for example, if you're prone to bipolar disorder, changes in your sleep cycle can really set off an episode. So sleep specifically can be a really tricky one. I think that we don't have, I wouldn't say we have empirically very good answers to what can be done, but I would say knowing what has happened in your past and knowing the things that worked then, anticipating that those might work again, trying to pull in supports, whether that's reconnecting with a therapist you used to have, making sure that you're taking medications that you were previously taking. These are sort of maybe the most, the clearest ways to work with that.
That's really helpful advice. I would just also add that just because somebody is experiencing grief or prolonged grief does not mean they cannot also have developed a major depressive disorder. There is no exclusion criteria that you can't be depressed and in grief. And so the depression should be treated, and that may help the prolonged grief problem as well, but that should be at the top of the treatment list.
Absolutely.
So there's an excellent question here. Providing psychosocial care to a geriatric or non-geriatric disabled population will take its toll on the clinician. Any suggestions on how to reinvigorate those of us who are on the giving end of the equation?
Yeah, boy, that is an excellent question. I think I sense the burnout among both professional caregivers and family caregivers during such a challenging time. I think, we think first of just supporting the physical body. So trying to find ways to get exercise, trying to find ways to get enough period of time to sleep in. Those are really critical to supporting us psychologically as well. Getting out and seeing friends, things that are so important to just our basic functioning. But the reinvigorating, I think, is an interesting question. So as I've been talking to folks who have experienced a death during the pandemic, one of the things that has been really noticeable is I talk with them about what in psychology we call post-traumatic growth. And what that means is often having a death or having a major life event like a pandemic can really help us to suddenly become aware of what is important to us, what is really valuable. You may have had this experience of like, who did you reach out to during the pandemic? Those are probably your very closest friends and family. And there is a way in which if we can focus and savor that, both that we have this new knowledge and also to go with it, right? To then strengthen the things that are so important to us. That can be invigorating, and let some of the other stuff go. I don't go to the grocery store on a regular basis now, or I don't worry if the, room isn't vacuumed, or, letting some of that go, because now I really understand what's important and I can sink into that, can be very invigorating, I find.
I would agree with everything you said. And I think also if there are therapists or clinicians who are listening, this is a tough job, providing grief care to our patients. And so seeking consultation and supervision and group talk with your colleagues and sharing how you are responding to working with these folks is really important to our rejuvenation and longevity. So there's a good question here about how is COVID grief affecting children and adolescents? I think that it would be good if we touched on this.
Yeah, this is a really good point. I will, full disclosure, I am not a child psychologist, and so this is not an area of expertise for me. However, I will say that, one of the most important things that we know for children is structure. This has been a period of bizarre lack of routine and schedule. And so I do know that trying to create a scenario where they can predict what's going to happen day to day can be very helpful when something as traumatic as a loss, the death of a loved one, has happened. I would also say that there are just such excellent programs where you can learn more about how to talk about it with a child, but also with a teenager who may really withdraw during a period of grieving. And those include in Tucson, Tunadito, the hospice in Phoenix open to, Hospice of the Valley, they will provide really excellent outreach. Even if the person didn't die in hospice, bereavement support is a part of their role. But you may have things to add to that, Jordan.
No, I think that's great. Thank you for that. So how do we support, this is another question, how do we support people who have experienced a death during the pandemic that is compounded, particularly for African Americans, by the racial justice problems that we continue to experience, especially around the time of George Floyd's death.
Boy, this has been such an overlap, hasn't it, in sort of a reckoning with our mortality and a reckoning with institutional racism all at the same time. What a double whammy. Not that, both have existed before, but this was just a point where the focus on that became very enhanced. I think one thing I would say, if you're what we might call grief adjacent, so someone, you're trying to help someone, you're trying to support someone who's grieving, I like to make an important distinction. Your goal is not to make them feel better. Your goal is not necessarily to get them to stop crying even. The goal is to be with them and witness and listen to and understand what they are going through. It can be helpful as a person on the outside. When a kid falls down in the playground and scrapes their knee, and you might rush in and hug them and kiss them because it's how much it hurts. But you might also stay where you are and kind of give them a thumbs up and, sort of try and encourage them. Because from your perspective, that they're going to get through it. And so I think a flexibility in how we support the people around us in those two ways, right? The sort of tender, loving care, and also the encouragement and strength that we can, give to people. I think both are really important.
Mary Frances, in your discussions with people who have experienced loss during the pandemic or even pre-pandemic, have you observed an increase in addiction and substance use?
Definitely. We know, I know largely about this from Pima County because that's the county I'm in, but we do know that overdoses, and especially overdoses among younger people, have gone up a great deal during the pandemic. And this is important just to know. It has even impacted things like programs to make sure that we're carrying antidotes for overdose and and things like that, but also to just take very seriously when you know someone that you suspect may be trying to self-medicate, right? And especially someone who doesn't have a lot of knowledge yet about what they can handle. And so I think it is true that this has happened, and also not shying away from those conversations is really important.
Mm-hmm.
I've seen in the people that I've been talking with, they aren't just COVID-related deaths. They're suicides and overdoses as well. That
Mm-hmm.
was an excess.
Mm-hmm.
Yeah.
Thank you. So I know that you included the Columbia Center for Complicated Grief as one of your resources, and I've been a fan of Kathy Shear for a long time, so I'm glad you included that. And if people take a look at that when they get Mary Frances's slides, there are tools and screening instruments, and one of them is the Brief Grief Questionnaire. But Mary Frances, if you were to recommend to therapists or psychiatrists or PCPs who are on this webinar, or we want to get the word out, how would you encourage them to screen their patients for prolonged grief?
Yeah, it's a good question. And you're absolutely right. I would definitely use the Brief Grief Questionnaire, which is hard to say. It's just 5 questions, and it really can give you an insight into what's happening. I think that, for me, if it's early on, part of what's so important is telling them they can come back. So, early on, it can be hard to distinguish between acute grief and what's going to go on to become a grief disorder. And so importantly, I think pausing, connecting with them, saying, I hear that there's a loved one in your life who's gone. I want to understand more. Tell me about what you're experiencing, but also know that this is a difficult and disruptive time. If this continues, I want you back in my office 6 months from now. That in and of itself, I think, provides hope for people who are just sort of bombarded by the strangeness of this experience,
yeah.
But also then would enable you to know more about the trajectory of what's happening if you see them more than once.
That's helpful advice. Thank you. I feel like primary care physicians, who are the docs who most people see, have so much to deal with. They're doing their best to address depression and anxiety. And given the likely wave of prolonged grief disorder that is going to be hitting across the world, we need to spread the word for screening and helping to get these folks into treatment as needed.
Yeah. And I think, there is this desire, I think, to hand a prescription, right? Like you want to give them something, and that's something you can give. I would say discriminating between depression and acute grief is really important. If this is not a person who has a history of depression, especially if they tell you, I don't think I'm depressed, it's probably not useful to give them an antidepressant, the empirical research suggests. Also, not giving them a benzodiazepine to sleep. We know it does not help their grief and ultimately can prevent a, sort of reorienting of their circadian rhythm. So I would not give that either. Instead, give them a prescription for a good website, good sources of what is normal, what can I expect, so that they have something to take with them, but it's not necessarily a medication.
Helpful advice.
Yeah.
We have a very engaged audience and a group of participants. I'm so glad.
I just want to say it's the New Song Center. Someone I saw put it in the Q&A. It's the New Song Center that's part of Hospice of the Valley, and that's the part that's the bereavement support. I couldn't pull it.
So we have a participant who wrote, as a chaplain in care management, I engage with people dealing with grief on a daily basis. Where can I receive in-depth training on managing and treating COVID-related grief, or I would say prolonged grief disorder, and being able to distinguish what is grief counseling versus complicated grief therapy?
Yeah, it's an excellent question, and it had not dawned on me that we would have a lot of clinicians, but of course we do in the audience. So I would say the Complicated Grief Center in New York is probably the first website I would go to. They really have just a plethora of resources that are for professionals and for the public. So there's a nice distinction there to help you navigate as a clinician. I think there are some excellent books Robert Niemeyer, who is with now the Portland Institute, used to be with the University of Memphis, and has written some really excellent books on sort of narrative therapy, sort of understanding the story of your life when this has been a chapter in it. I'll be honest, you know, it is a bit of a challenge to find the right resources. I think, especially now that it's just been included in DSM, I think we will start to see better resources. I don't know, Jordan, do you have any other recommendations?
No, I think that checking out the Columbia Center for Complicated Grief, because they might, I don't know, but they might have remote supervision available that people
They do
can pay
actually.
for.
Yeah, you're correct.
I think that that's a really clinician-friendly and useful website.
I would just also say, if you're connected to the sort of scientific literature world, Paul Bolen, that's Boelen, from the Netherlands, actually has done quite a lot of work with sort of CBT specific for grief. So it's taking skills you already know, but applying it in this context. And that's done both in a one-on-one, but also in a group format, which can be very effective.
I'm going to ask Angel if she would like us to continue taking these great discussions, or does she want me to move into my closing remarks? She's the master of ceremonies here, so she can tell me what to do.
I will say that I'm so happy to see the audience so engaged and such great questions, but we probably should move into closing remarks. And for those who didn't have a chance to get their questions answered, email IMHR_AZ@outlook.com, and we'll make sure to get you those answers. We appreciate you being here.
All right. Well, I want to thank Dr. Mary Frances O'Connor and all of you in the audience who joined us today. I'm feeling super inspired about having learned more about Mary Frances's innovative work, and mentally stimulated having spent time with such an engaged group of webinar participants. This has really been tremendous audience participation, so thank you. To learn how you can connect and help the Institute for Mental Health Research, I encourage you to visit our website at www.imhr.org. Our website also features a mental health resource page, including crisis lines if you are struggling or need help. So we will be sending you a follow-up survey and would appreciate your feedback. It helps us to continue providing programming on areas that matter to you. Give me 1 second, please. So I'd encourage you to please take a few minutes to complete that survey. It does make a difference. I promise you that we do review the surveys and we plan our programming based on what you say. Don't forget to mark your calendar for our next webinar on aging and preventing cognitive decline on September 9th, where yours truly will be speaking. I'm a geriatric psychiatrist, and the focus of my research is on treating depression in late life, promoting brain health and aging in place, and preventing and slowing cognitive decline. So please join us. I'd like to leave you with a final thought. So the mental health effects of the pandemic are going to be felt for years. However, while many people have experienced some stress, worry, sadness, and feelings of isolation at times during this difficult 18+ months, most people have not developed psychological or psychiatric conditions requiring professional help. I think that this really speaks to the resiliency of the human condition. And this is an opportunity for us to learn from and to care for those who are in distress, but it's also a time of hope, promise, and preparing for a better world. So I'd like to thank you all again for joining, and I wish you well for the rest of the day. Thank you.
Thanks, everyone.
you.